Welcome to Chewy Tubes. I'm Mary Schiavone, the inventor of the Chewy Tubes, and it's my pleasure to take a few moments today and introduce you to the family of Chewy Tubes. What are Chewy Tubes? Chewy Tubes are an innovative oral motor tool designed to develop biting and chewing skills. Chewy Tubes were originally designed to be used with the jaw rehabilitation program. Chewy Tubes are also used to develop tone and strength in the masseter muscle in order to assist with jaw opening and jaw closure. What are Chewy Tubes made of? First of all, Chewy Tubes are made in the USA. They're comprised of a safe and non-toxic thermoelastic polymer material, which is FDA approved. In fact, there is no lead, no latex, no PVC, and no phthalates in Chewy Tubes. All materials are non-toxic and FDA approved. Chewy Tubes are a registered product with the U.S. Food and Drug Administration. Chewy Tubes are composed of two parts: the long biteable stem and the corrugated handle. The biteable stem is placed into the mouth laterally from either the right or the left side. The patient then bites down on the stem using their molar dentition or molar gum ridge. Here we have Thomas biting on the red Chewy Tube. Chewy Tubes are designed with a resilient, chewable stem, shaped for comfortable placement between the upper and lower molar dentition. A Chewy Tube is easily held in place by the patient or therapist by grasping the corrugated handle. The entire surface of the Chewy Tube, including the stem and handle, is soft and pliable, free from rough corners or edges. Chewy Tubes themselves are non-edible. Biting on Chewy Tubes also provides proprioceptive input directly into the temporomandibular joint. This helps to mature biting and chewing skills. Now let's take a look at the individual Chewy Tubes and how they are used. The yellow Chewy Tube has the narrowest biteable stem and is typically used with infants and individuals who demonstrate sensory defensiveness to oral stimuli or who have a small mouth, such as children in the age range of 9 to 24 months. In the adult population, yellow Chewy Tubes are used with adults who may have a small jaw or with those who have a tendency towards clonus or trismus or those recuperating from stroke or oral surgery. In addition, they are used with patients in skilled nursing facilities who want to preserve the strength and tone of the masseter muscle for oral feeding skills. The red Chewy Tube has a wider biteable stem, which is actually a ½ inch outside diameter, and it's typically used with children 2 years of age and older after their mouths have grown a bit. Many children have already had quite a bit of practice biting on the yellow Chewy Tubes before they move up to the red Chewy Tube. In the adult population, adults use the red Chewy Tube in stroke rehabilitation exercises, post-oral surgery intervention, and post-radiation treatment of the jaw. The green knobby tube has little bumps all around the biteable stem, which provide additional oral tactile sensory input for children and adults. Typically, a child would be 3 years of age or older before using the green knobby tube. The blue Chewy Tube is the largest and firmest of the tools in the Chewy Tubes family, and it is intended for the adolescent or adult-sized jaw. Adults with developmental disabilities and adolescents with autism or sensory integration disorders may wish to use this larger size. The Super Chews are solid in design and recommended for toddlers. The handle is easily grasped by little fingers. The red Super Chew has red knobs on the biteable stem that add a little more tactile sensory input into the mouth. The green Super Chew has a fun and smooth biteable surface. P's and Q's are solid oral motor tools. The Q offers fun and safe mouthing experiences for infants 4 and 5 months of age and older who are especially using their tongues in early mouthing activities. Both the P and the Q can be easily held by infants using their early fine motor grasping patterns. The P is recommended for infants 9 months and older. To clean Chewy Tubes, wash them with mild soap and water. You may also place them on the top rack of your dishwasher. Replace your Chewy Tubes when there are visible signs of wear. It's been a pleasure talking with you about Chewy Tubes. In the United States, you can call us at 207-741-2443. Visit us on the web at chewytubes.com.